And bring us right down to indications and clinical use. So in adults, escitalopram, or Cipralex, is indicated for the symptomatic relief of major depressive disorder, or MDD. The efficacy of escitalopram oxalate in maintaining an antidepressant response in patients with major depressive disorder who responded during an 8-week acute treatment phase while taking escitalopram and were then observed for relapse during a period of up to 36 weeks. Was demonstrated in a placebo-controlled trial. So escitalopram is indicated for the symptomatic relief of obsessive-compulsive disorder, or OCD. The obsessions and compulsions must be experienced as intrusive, markedly distressing, time-consuming, or interfering significantly with the person's social or occupational functioning. The efficacy of escitalopram in maintaining an anti-obsessive response for up to 6 months in patients with obsessive-compulsive disorder was demonstrated in long-term placebo-controlled trial in patients who initially responded to 16 weeks of escitalopram in open-label treatment. Physicians who elect to use escitalopram for extended periods should periodically reevaluate the usefulness of the drug in individual patients. Now, what about geriatrics? So patients over 65 years of age. So elderly patients should be administered lower doses and a lower maximum dose. For pediatrics, so 18 years or less of age, it is not indicated for the use in patients below the age of 18. So now contraindications. So escitalopram is contraindicated in patients with a known hypersensitivity to escitalopram or any excipients of the product. This is kind of standard for every medication. It is contraindicated in patients with known QT interval prolongation or congenital long QT syndrome. And then we have medications here. So monoamine oxidase inhibitors, or MAOIs. So cases of serious reactions have been reported in patients receiving selective serotonin reuptake inhibitors, or SSRIs, so that would be Cipralex, in combination with a monoamine oxidase inhibitor or a reversible monoamine oxidase inhibitor, which is a REMA, meclobamide, and in patients who have recently discontinued an SSRI and have been started on an MAOI. With the co-administration of an SSRI and an MAOI, there have been reports of serious, sometimes fatal reactions, including hyperthermia, rigidity, myoclonus, autonomic instability with possible fluctuations of vital signs. The mental status has changed in some individuals, including extreme agitation, progressing to delirium and coma. Some cases presented with features resembling serotonin syndrome. Therefore, escitalopram should not be used in combination with an MAOI or within 14 days of discontinuing treatment with an MAOI. This includes linezolid, which is an antibiotic, which is a reversible non-selective MAO inhibitor, MAOI, and methylene blue, which is an MAOI. Similarly, at least 14 days should elapse after discontinuing escitalopram or Cipralex before you start an MAOI. We also have pimozide here. So escitalopram should not be used in combination with the antipsychotic drug pimozide. As a result, from a controlled study with racemic citalopram, that would be Celexa, indicate that concomitant use is associated with an increased risk of QTc prolongation compared to pimozide alone. So pimozide cannot be used with escitalopram or citalopram, so Cipralex or Celexa.